Ischemic and hemorrhagic strokes are two distinct types of strokes that occur due to different mechanisms, and they have varying symptoms and treatments. Ischemic stroke. An ischemic stroke occurs when a blood vessel supplying blood to the brain is obstructed, usually by a blood clot. This obstruction deprives the brain tissue of oxygen and nutrients, leading to cell damage and potentially irreversible brain injury. The symptoms of an ischemic stroke can vary depending on the location and severity of the blockage, but may include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, difficulty walking, dizziness, loss of balance or coordination, severe headache with no known cause. Hemorrhagic stroke. A hemorrhagic stroke occurs when a weakened blood vessel ruptures and leaks blood into the surrounding brain tissue. This bleeding can result from conditions such as high blood pressure, aneurysms, or arteriovenous malformations. The symptoms of a hemorrhagic stroke can also vary but may include sudden severe headache, often described as the worst headache of one's life, nausea and vomiting, weakness or numbness on one side of the body, changes in vision, such as blurred or double vision, loss of consciousness or coma. While both types of strokes can cause similar symptoms, there are some differences. Headache is one such distinction, with hemorrhagic strokes typically causing a sudden, severe headache, while ischemic strokes may or may not induce a headache. Additionally, nausea and vomiting tend to be more commonly associated with hemorrhagic strokes. Furthermore, loss of consciousness is more frequently observed in hemorrhagic strokes, with individuals being more likely to experience coma or a loss of consciousness compared to ischemic strokes. Understanding these nuances is essential for prompt diagnosis and appropriate treatment of strokes. Diagnosis and treatment. Both types of strokes require urgent medical attention. Diagnosis usually involves imaging tests such as CT scans or MRI scans to determine the type and location of the stroke. Treatment may involve medications to dissolve blood clots in the case of ischemic stroke, or surgery to repair or remove the ruptured blood vessel in the case of hemorrhagic stroke. In summary, ischemic strokes are caused by blockages in blood vessels, while hemorrhagic strokes result from bleeding in the brain. Understanding the differences in symptoms and causes is crucial for prompt diagnosis and appropriate treatment.